Hello, this is Dr. Utsa Basu. I'm a consultant physician and diabetologist from Kolkata. Today, I would like to share with you a topic that is management of hypertension in diabetes patient, the RSSDI recommendation of 2022. We all know that hypertension and diabetes are two of the leading lifestyle diseases in the Indian and South Asian population that often coexist due to overlapping pathophysiological factors. Obesity, insulin resistance, inflammation, and oxidative stresses are thought to be some common pathways. Up to 50% of hypertensive cases in India are diagnosed with type 2 diabetes mellitus. Now, the recent RSSDI guidelines of 2022 provide comprehensive recommendations for managing hypertension in patients with diabetes. First, as per the Indian guidelines of hypertension 4, hypertension is defined as systolic blood pressure of greater than equal to 140 millimeter of mercury and or diastolic blood pressure of greater than equal to 90 millimeter of mercury. Number 2, primary hypertension is mostly asymptomatic, while secondary hypertension is due to various underlying pathologies. Uncontrolled BP, despite the usage of 3 antihypertensive drugs, is referred to as resistant hypertension. Over 1 billion people suffer from hypertension globally, which is expected to rise up to 1.5 billion by 2025. So up to 50% of cases of hypertension are also diagnosed with type 2 diabetes. Hypertension presents as a major risk factor for heart failure, CVDs, CKDs, PADs, EDs, and end organ damage. There is a complex cause-effect relationship between hypertension and diabetes, which predisposes the patient to increased risk of cardiovascular complications. Number 5, the patients with diabetes and hypertension, 24-hour ambulatory blood pressure monitoring is recommended to maintain BP targets of 120 to 130 millimeter of mercury. The usage of an Android sphygmomanometer must be preferred over digital devices. However, digital machines may be preferred for home-based managements. Blood pressure threshold vary with age and comorbid conditions. Number 6, non-pharmacological management of hypertension in diabetes patients. Lifestyle modification may delay the need for pharmacological interventions or can complement the BP lowering effects of drugs. A low sodium diet, a physical activity, and a healthy diet are recommended to manage hypertension in diabetes patient. Number 7, pharmacological management of hypertension in diabetes patient. First, ARBs are recommended as the choice of therapy, preferably in combination with CCBs to manage hypertension and its resulting complications. For combination therapy, newer CCBs, example, cilnidipine along with ARBs are recommended. Then, cilnidipine is a novel, effective, and safe CCB, which is established for its renoprotective benefits. Then, combination of these ARBs with thiazide-like diuretics also reduces the risk of renal disorder. While telmisartan can be the first-line ARB for treatment of diabetic hypertensive due to its beneficial effects on fasting blood glucose and insulin levels, alternatively, azilsartan with a similar safety and efficacy profile is also recommended. Thiazide-like diuretics can be preferred in elderly patients with existing CVDs. ACE inhibitors may be used as an alternative to ARBs for CVD risk reduction in high-risk patients. Beta blockers may be preferred in patients with a previous history of CVDs and as an alternative to the rash blockers in pregnant women. So the summary is hypertension is a strong modifiable risk factor for the macrovascular as well as microvascular complications of diabetes. Strong evidence from clinical trials and meta-analysis supports targeting blood pressure reduction to at least 140 by 90 millimeter of mercury in most adults with diabetes. Lower blood pressure targets may be beneficial for selected patients with high cardiovascular disease risk if they can be achieved without undue burden, and such lower targets may be considered on an individual basis. In addition to lifestyle modification, multiple medication classes are often needed to attain blood pressure goals. Thank you.